Dr. Cosey's medical assistants, and I'm just in here to take some vitals from you, okay? Okay. She is running on time today, so you shouldn't have to be in her waiting for too long. Really quickly off the bat, can I just have you verify for me your name and date of birth? Perfect, thank you. Okay, and then I just need your arm so I can take a pulse rate. Either one. Thank you, okay. Looks like your pulse rate is 84. So then this just goes right under your tongue. Perfect. Okay. 98.7, that's good. Okay. And then I'm just going to, actually first let me write this down. Okay. So now I'm just going to put a blood pressure cuff on you. And it's actually going to stay on you for the duration of your visit, okay? Yeah, because we know that some people get something called white coat syndrome, where their blood pressure actually goes up because they're in a doctor's office. So this way we can get a more accurate measurement, because that way as you get used to being here, your blood pressure will get into a more normal range. I'm just going to slip this around your arm, okay? So you're going to feel that tightening and loosening over time. Okay. So then I'm just going to wait and get the initial reading here. is a little bit high. Okay. So you just sit tight, okay? And I'm gonna go let Dr. Cozy know that you're ready. Hi. My name is Dr. Cozy. It's really nice to meet you. And okay, so my medical assistant got your vitals. Do you know what your blood pressure tends to be on average? Okay. Do you have a tendency to get a little bit of anxiety at the doctor's office? It's totally okay. I just noticed it was a little bit high, so we will just track it over time, okay? So, okay. Looking here, it says you've been experiencing some dizziness, floaters in your vision. Okay, when did that start? Have you had any kind of loss of consciousness, any fainting? Okay. Any fever, elevated temperature? Okay. Yeah, your temperature is in normal range today. Any nausea or vomiting? How about chills or any night sweats? Okay. And any recent change to your diet, exercise, activity level? Do you smoke? And how about any alcohol use? Okay. Well, let's get started here. So right off the bat, I'm actually going to do something called the swing test, where I'm going to be flicking my light in and out of your eyes and just watching your pupils as they retract and relax in response to light. However, one thing I want to do along with that is I would like you to tell me if after I finish this test, if you're still seeing that light in your vision, and then for how long, okay? Look straight ahead for me. So you are still seeing it a little bit. Alright. Are you seeing it in both eyes? Just one? Okay. Take a quick peek in your ears, okay? So, start on this side. And just going to feel me pulling the ear back, okay? Any pain or discomfort due to my otoscope? Okay. Not seeing any kind of redness or irritation inside of the ear. Tympanic membranes are intact, so that's good. Let's check the other side. Like I said, are intact, like there's two in your ear. So now you're going to feel me pulling the ear back on this side. This side looks good too. I don't see any sign of inflammation or irritation inside of the ear. Any tenderness or anything on this side. And then while I have a cover on my otoscope, I'm just going to take a peek inside of your nose, okay? Can I just get you to open for me, please? Thank you. Okay. No, I don't see any redness or swelling. Your tonsils look good. Normal size. Up there. So now I'm going to take a listen to your chest. Okay. And have you been experiencing any kind of shortness of breath at all? Okay. How about any feelings like your heart is racing, palpitations? Can I get you to take a deep breath in for me? And out. Good. And again, deep breath in. And out. Again. One more time. Okay, you can breathe normally. I'm just listening to your tummy now. And then I'm just going to give your abdomen a feel here, just to make sure everything feels a nice normal size. Let me know if you experience any kind of tenderness or discomfort. And one more thing I want to do is just feel around your jaw and down your neck, just feeling for any kind of swelling or lymph node enlargement. Feel under your arms for just a sec. Sorry if this tickles. Okay. So I'm not seeing anything remarkable going on there. So I'm not able to see on exam any kind of cause for your symptoms, okay? And are you still seeing that light in your vision even now? Okay. So here at the hospital, we do sort of function as a co-op, and it is quite common for us to get in touch with our other specialties while a patient is here and have them come in and give an exam, so that way we can all kind of work together as a team and figure out what's going on, okay? So what I'm going to do is I'm going to pass your chart off to one of our ophthalmologists that are currently working today and have her come in and take a look at you, okay? Okay. I'm not sure how long the wait will be. It depends on the flow of her current clinic at this time, but hopefully it shouldn't be too long. If it is going to be a long wait, I'll come back in here, or I'll have one of my medical assistants come back in here and let you know, okay? Okay, so you sit tight. Hello. Hi there. Are you alright? I hope you haven't been waiting too long. My apologies if it's been quite a wait. I do have my own current practice running at the moment, and well, we are a little bit backed up, but I'm definitely always willing to make a moment for Dr. Cozy. So, alright, taking a look here. So there is a little bit of an increase in your blood pressure. Let's take a look at the monitor for a moment. Okay. Well, it does appear to have lowered a little bit from when you first came in. How are you currently feeling? A little bit of anxiety, that's understandable. And alright, so you're experiencing some floaters in your vision. Okay, some dizziness. How about, are you able to read alright? Any headaches, blurred vision? Okay. Are you experiencing a headache right now? Okay. How intense would you rate that? Place that to the side for the moment, and I'm going to just pop on some gloves. And if it's alright with you, I'd like to move a bit closer. Do you feel comfortable with me touching your face? Cheers. I would like to start our exam today just by lightly palpating around your eyes and seeing if I can detect the presence of any sort of inflammation, the presence of any infraorbital lymph nodes or abnormalities that might be contributing to the symptoms that you've been experiencing. So I'm going to start, okay? I'd also like you to let me know if you feel any sort of pain or discomfort? You do have gorgeous eyes. The colors are quite lovely. I'm not feeling anything that I would consider concerning. And it looks like Dr. Cozy already performed the swing test, so we'll spare you from having to do that again, but I will be using a light. I have a mist light. I was wondering what was tickling my arm. Alright. So, as you can see right here, we do have a vision chart on the wall, and I just want to make sure that whatever is occurring is not affecting your visual acuity, alright? Okay. So, are you able to read line 4 for me? Well done. How about below it? The 5th line here. Okay. And let's move down to 6. Lovely. 7. Okay. Number 8. And are you able to read for me number 9? That's alright, okay. So your vision is intact. And while you're reading the lower numbers here, were you experiencing any sort of eye strain? Before I introduce our light to our examination, I just want to take a look at your eyes, okay? So, I'm just looking at the sclera, which are the whites of your eyes surrounding the iris. Looking for any discoloration or irritation of any blood vessels. May I please have you look up? Cheers. Okay. And then, if you don't mind, look to the right. Good. And to the left. Lovely. And I'm very lightly going to just pull your upper lids up. I invite you to look down. Okay. Well, on the surface, your eyes appear to be in a wonderful state of health. medical assistant was kind enough to bring me my retinoscope, which is lovely. Right. So this here is called a retinoscope, and I'm going to be looking very closely into the retinas of your eyes. Alright? The light can get a bit bright. Looking for any sort of abnormalities that might indicate any sort of changes in vision or any cause for the symptoms that we're able to see. So, if you notice behind me, there is a painting on the wall of a plant. I'd like you to focus just there, right? And while you're focusing, beautiful, I'm going to be taking a look at the retinas here. Okay. Take a look at the other side now. So again, just looking over my shoulder. Remove our light. Your retinas appear to be in good health. Pack that up here. Take a quick note. Right, so unfortunately I'm not able to diagnose based on our exam today. However, due to the fact that you are experiencing this dizziness, I do think it warrants a visit from my colleague in the ear, nose and throat department. So if you don't mind waiting just a few moments, I'm going to pop into her clinic and see if she's available to come in and consult with you, alright? Okay. So just so you're aware, if if you do start experiencing any sort of unpleasant symptoms while you're in here, while you're waiting, there is a button here on the remote control that you are welcome to push. It will alert the nurses station and someone will come in and assist you right away, okay? Okay. Do you have any questions for me? Okay. Well, then I'm going to go ahead and contact my colleague and she'll be in hopefully right away, okay? Cheers. Oi, tudo bem? Bom dia. Que foi? Que foi isso? Não, eu não falo espanhol. Tô falando inglês, prometo. Você não tá me entendendo? Interessante. Você está experienciando alguma tontura? Eu vou ligar algumas luvas e começar o exame. Então, eu gostaria de dar uma olhada nos seus ouvidos. Pode ser? Meu otoscope nos seus ouvidos, tá bom? Obrigada. Vamos começar. Aí, ó, no outro lado. Augmentando a sensibilidade neste lado, neste ouvido. Vendo inflamação neste ouvido. Tudo bem. Não caia, por favor. Ok. Minha colega já virando assim a garganta. Então, ok. Eu preciso virar sua cabeça de um lado para o outro enquanto observo seus olhos. Estou procurando por algo chamado nistagmo, tá bom? Ok. Então, vamos começar. Alguma tontura? De novo. E agora? Nenhuma tontura? Nada? Mais uma vez. Alguma tontura agora? Você tá sentindo alguma ansiedade, dor de cabeça? Tente deixar pra lá, tá bom? Eu tô um pouco preocupado por causa do fato que você não tá me entendendo. Eu não tô falando em espanhol. E tô falando em inglês. Então eu vou pedir ao meu colega, a neurologista, para vir a examiná-lo, porque eu não tô entendendo o que tá acontecendo com você, sabe? Tá um pouco. Tal não é ideal. Seus ouvidos parecem muito bem, muito limpos. Então eu não tô preocupado sobre isso, porque eles parecem bem. Mas eu acho que alguma coisa tá acontecendo, talvez com seu cérebro. Então eu vou ter você esperar aqui e espero que muito logo minha colega possa vir e examiná-lo, tá bem? Tá bom? Um minutinho, tá bom? Knock, knock. Hi there. My name is Dr. Cranio. It's really nice to meet you. And I came in here just now because one of my colleagues in Otolaryngology, she was a bit concerned about you having some difficulty understanding her. Yeah? Can you tell me a little bit about that? Are you having a hard time processing language? You're able to understand me? Okay. No, she doesn't have an accent. That's interesting. Well, we're gonna do some testing here, okay? And see if we can't figure out if there is some kind of neurological origin to your symptoms. So, just off the bat, I'm just gonna put on some gloves here, just on the off chance that we might be making some contact with each other. And that way everything stays nice and sanitary, okay? So, first things first, if you don't mind, I'd like to stand up and just take a quick peek at your head, alright? Thank you. Just trying to see if there's any kind of bumps. Maybe you hit your head and just don't remember. Wouldn't be the first time. tell you I'm not feeling anything that would indicate that you had any kind of head injury, so I think we can rule that out. So, okay, let's take a look at what these other doctors have done today with you. So I did take a look in your ears. Dr. Cozy did as well, and she did do a swing test, and looks like you are seeing that light in your vision for a good time after. Yeah? You still seeing that now? Okay. But you are seeing floaters, yeah? That in both eyes? Okay. So, let's see, okay? Just gonna cover one of your eyes if it's okay with you. Thank you. Okay. You seeing that floater? How about on this side? Now? And now. One more time. Now power. Okay, but you said you see it when you have both eyes open together. Interesting. Okay, let's do a test. I'm gonna do that swing test again, but I'm gonna do it just a little bit differently than Dr. Cozy did it, okay? That means I'm gonna cover one of your eyes like so, and boop. Boop. And boop. Okay. So, both eyes open. And then, both eyes closed. And just this side open. Still seeing that light? Okay. I'm going to do the other side now, okay? So, covering. And boop. Boop. And boop. Okay. Both eyes open. Both eyes closed. Just this eye again. Still seeing it? But both eyes are seeing it? Interesting. Okay. My light right here. I don't want you moving your head at all. I just want you to follow it. Just using your eyes. Very nice. Up. Down. Across. And down along the bottom. And when you were following my light, were you feeling any kind of strain, any pain, any kind of headache sensations at all? Okay. Can you tell me, is my light brighter here or here? How about here or here? Here, here, and here, or there. All right. Alright, so now it's gonna look like look, I'm gonna poke you in the eye, okay? And I promise you, I'm not going to, okay? It's just gonna look like it. I just want to make sure that you blink in response to the threat of my finger. Good. Okay, good. So then, get my little pointer here. And what did I drop? Oh, that's fine. So this is a ruler, but I'm not going to use the side with the numbers. We're going to use the other side because I don't want you cheating. And I want you to tell me, is this point closer right here than this point? Okay, how about here, closer than there? Okay, this closer than here, and here closer than there. Okay, here closer than here, and here closer than there. Sorry, here closer than there. Alright, turning this to the side, is this side closer to your left than here? And here closer than here to your right? Good. Alright. We'll put that to the side here. Alright. So, see my finger right here? I want you to poke it with your finger. Good. Again. Again. Here. 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 Alright. So one more test we're gonna do, which is called the Extinction test, and I'm gonna squeeze you, and I want you to tell me when you feel me stop. Okay? Okay. So we're gonna start. Very good. 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 And, oh, look at that. You have quite the rash here going around your forehead, around your eyes. And it looks like it goes to each of your ears. Have you noticed that? Okay. Have you tried putting any medication on it? Well, I'm going to tell you what. I'm not seeing anything on my exam, but I do think that maybe it's worth having dermatology coming in here and assessing you. So, now I will say that dermatology does tend to be quite a bit on the busier side, so you might be sitting here for a little while. That being said, I think it's a good idea to have her come in and consult on you because quite the rash there, and I do think it's worth taking a look at. I do. So, you sit tight, and I'm gonna go get her and see if she can come in and take a look at you, okay? Okay. Knock, knock. Hello, hello. Hi. I'm here from Derm. I hear that you have a little rash on your skin. Oh, let me take a look at that right away. Oh yeah, that looks really uncomfortable. How long you had that? Alright, we're gonna take a closer look. Ugh, always the blue gloves in these exam rooms. In my room, we have pink. And let me tell you what that does for the morale. Everybody likes pink. They might say they don't like pink, it's a lie. Everybody, somewhere deep inside them, they like pink. But alright, for now, we'll do the blue. It's fine. So, okay. Let's take a closer look at you. Yeah, look at that. Going all the way up into the hairline. Into the ear. Can I have you close your eyes for just a second? I just want to see on the eyelid. Yeah, look at that. Would you just look at that? Just look at it. Would you just look at that? It is very scaly. Okay, don't open your eyes. Keep them closed. We're going to do a little testaroo here. I want to see if I irritate the skin. Now, which end is the up end? Oh, I'm blind as a bat unless I get really up close with my glasses sometimes, you know, but we're going to do our best. That's all we can do. All right, love. my love, I want you to keep those eyes closed. We're gonna do a little scratchy here because I want to see if I scratch away some of this flaking. Okay, you can open. I'm gonna do above the eyebrow now. Yeah, look at that. There's a little bit of the weeping skin happening here. It's quite the extent here. Well, I do have a magnifying glass that we're going to use. We're going to take a closer look. It does have a light. Are you okay with the light? Well, from what I'm seeing here, you've been dealing with neurology and ophthalmology, so yeah, you're probably used to the light by now. And if you're not, well, you'll get used to it again. So keep yourself still. Don't move, okay? Stay completely still, because here's the thing about moving. Okay, we have facial features that protrude like the nose, and it can cast a shadow on this face. When we move, it can kind of change the position and can kind of throw off my interpretation of what's going on. So I just need you to stay really still for me for just a few minutes. You can do this. I know you can. And while I'm looking, I want you to tell me about your skincare routine, any new products. Put the light away. Just gonna do a little measure of the extent of this rash, because if it starts to spread, we want to know. So I'm gonna do from here to here. Okay, what does that say? Okay, and then it looks like we've got from the hairline down towards the ear. Yeah, I need you to close your eyes again for me, okay? Just keep them closed. We don't want you peeking. We just need a little measure of the eyes here. Honey, this is quite the rash we got on our face, and I'm seeing in your paperwork here that we didn't mention it until our little lovely neurologist noticed it. How's your eyesight? Yeah, having some trouble? No? Okay. Well, that's fine. Not sure how we missed this, but that's fine. I'm gonna have to consult with Dr. Cozy and see how her eyesight is, because I'm not quite sure how she missed it either. Oh, don't mind my stomach. When you get to a certain age, sometimes it always wants to join the conversation. Nobody invited you, and yet here you are. So, okay. And that was, hold on, let me look at this measurement one more time, because I have a pretty good memory, but sometimes I lose some information. All right. Yep, and that is basically symmetrical. Well, at least something's symmetrical. If we could only all be symmetrical. All right. 5.1 and 2.6. So, okay. Just gonna take a little look-see here in your chart and there it is. Okay, I had a feeling. So it looks like recently you were on an antibiotic, yeah, for a little UTI. Yeah, I'm seeing that, and it was a strong one that they gave you. So what I'm thinking here is that antibiotic killed off all of your helpful bacteria along with the bad bacteria, and what happened is it invited a friend called Candida albicans, because this rash is pretty textbook candidiasis that we got going on here. No, don't you worry. It's nothing to do with your hygiene. I promise, okay? What it is just the fact that antibiotic, it helped open a door. What can I say? So what we're going to do is we're going to prescribe you a little fluconazole, okay? It is an antifungal medication that you're going to take, okay? You're going to take it for 2 weeks. You're going to take it twice a day, and you're not going to miss a dose, okay? What did I just say? Say it back to me so I know you know. Very good. All right. So let me just see here. Okay. We do have a pharmacy on this file. So I'm going to write up this script, but just real quick. How you been sleeping? Because that looks pretty itchy and irritated, yeah? You've been having a hard time sleeping because of the discomfort. And I'll tell you what, when you're not sleeping good, you're more prone to things like headaches, dizziness, even the floaters in your vision. So I bet that all along this is our culprit. Yep. So let's get this written up. I'm going to do a little fluconazole. I'm going to do 500 milligrams. 1 tablet, BID, quantity 14, 0 refills, and generic is fine. Okay, we'll do a little signing. And what is our date today? Okay, that's right, my God, we're already halfway through September. How did this happen? I don't even know. Ay. It doesn't stop, does it? It never stops. So, okay. All right. We're going to get this called in for you. I'm going to find a medical assistant. I'm going to have them call your pharmacy. The one I have on file, that's the one. Yeah, okay. And then I'm going to have them give you a little phone call, a little ring when it's done. So that way you can kind of have an idea of when you can pick it up. So let's see. This number that you have here in your chart that you put in the paperwork, is that okay to leave a message on that number? Okay. All right. So my dear, we're going to get that all taken care of for you. Okay, I promise. Don't you worry. So, do you have any questions for me? So it usually takes at least a week before we see any kind of improvement. So there's probably going to be a few more days where you're going to struggle with the sleeping just a little bit, okay? I do recommend trying not to scratch because you might spread the infection to some other places. So if you have to touch your face, wash your hands right after, okay? Okay, good. Good. So then, looks like we are all good here. So, I am going to go give this prescription to a medical assistant, and someone will come in here in just a few minutes and discharge you, give you some instructions if you need it, make sure you know what we're doing, and then send you on your way, okay? Ugh, okay. You are a great patient. I really appreciate the quick comprehension because, my God, a lot of the time we get those old alpacaas in the clinic, and well, it takes quite a few times of repeating, but never mind. Anyway, you take care, all right? Someone will be right in.